Hi, I'm Susan Nudowitz with Let'sFeelExcellent.com or the YouTube channel by the same name, Let's Feel Excellent. Welcome. I want to talk about something really important, and it's very, very common, although it seems like when it happens to people, they are very surprised, and that is pain. Pain when it stops the day that you had planned on having. That kind of pain, the kind of pain that makes people wonder, what did I do to get this? Well, that's a misconception right there, because the pain happened over time. That it's sort of like, if a person says that, it's sort of like going to their mirror and saying, oh, I have gray hair. I didn't see those yesterday. I wonder what I did yesterday to cause the gray hair. Of course you don't say that, because you have the knowledge that the gray hair happened over time, and so did the injury. But that doesn't mean it's because you're getting old and you just have to live with being old and there's nothing that you can do with it. Because infants even need a lot of work. Kids need work. What is happening is the connective tissue in that area is so dehydrated and so not in the right place to withstand gravity. And what happens is that it becomes weak, and the weakness is so prevalent in that particular area or close to that area. It doesn't necessarily have to be that area, but it's so prevalent that the weakness or whatever's exciting the nerves in that area are sending a signal to the brain and saying, don't move, do whatever you have to do for this person not to move, because we're going to break. And a lot of times people think that I need to fix something, say in their low back, which is incredibly common for a lot of people. They think I need to fix something or reverse something in their low back because they're having the issue there in that spot. And a lot of times the quadratus lumborum is spasming so that you don't move, and it's preventing damage on the disc, or it's preventing damage on the ligaments and the structures around the spine. So it's saying, okay, we have a problem here, whether it's a nerve problem or a ligament problem or a muscle problem or a tissue problem or a fascia problem, whatever it is, we have an issue here, and we don't want this person to move anymore, since we've sent them how many signals throughout the body forever here, and they're not listening. And you have had signals, you just didn't know how to read them. So like the gray hair, it didn't happen overnight. When a person has a sharp shooting pain, or pain that interrupts the day that they planned, then that is a sign that actually systemically, head to toe, that individual has a problem in their body. The structure is not functional enough to do the job that it needs to do on a daily basis. So it needs some help from head to toe. But what can happen for the person in the meantime, because after all, I do get these calls and, can you help me today? It really hurts. It hurts bad. I can't breathe. These kinds of things is distressing emergency calls. Yeah, I can, although I cannot massage the area itself, and it would do my clients a great disservice. Like I said, in the example of back pain in particular, it would do my clients a really big disservice to try to massage out the QL when it's actually trying to function as a back stabilizer at that point. So what I can do is I can make the other areas of the body support that area, and then that relieves the area that hurts, and then the inflammation can finish up its job, and the client is good to go at that time, just for that time. If the client has a lot of inflammation happening all over the body, or the nervous system is very excited, either really excited in that area or very excited in all other areas, I have to use other things, other modalities, like lymphatic drainage or craniosacral. And what those modalities will do is they can go in and actually help the body with the inflammatory process, actually clear it up. And that's not something that an NSAID would do. An NSAID does the opposite, and we'll talk about that in a little bit. But what those two other modalities do is, number one, as a byproduct, they calm the nervous system way down. And what that does for the body is now the body can have the resources that it can to heal itself, if it can get into the area. If the little lava tubes, the little lymphatic lava tubes, as I call them, are compressed, they're glued together, or they just won't let go, then the lymph can't get into the area as effectively, and it takes longer for that process to happen. And so allowing those rivers of the body, is in particular the lymphatic system, to flow, then we can actually have some we can resolve the problem. And what my clients call that is a fix. They say, you fixed me, and that was great. Now, what happens if the person just rests for a couple of days or a week, or sometimes 2 weeks people take to rest? What happens if the pain suddenly goes away tomorrow? Does that mean the person doesn't have a problem anymore? No, it doesn't. And it's the same thing with people that don't feel pain in their body. People that don't feel pain, let me just segue to that for a moment. The people that don't feel pain, it doesn't mean that they have a perfectly functioning system, although they might be really, really healthy people and they might be aligned very well. But and I'm talking about the people that might exercise but don't really do any of the other of the 5 pinnacles that I talk about. You know, they don't really mind their diet, and they never get body work, and they never do any stretching really to speak of. Those kinds of people are what we call coated. Literally, their nerves are coated to the point where they're desensitized. And they can be desensitized in their psychology too. So they can either have a high threshold to pain, so they need to have something more catastrophic happen in their life, or they might have a lot of adipose tissue, a lot of weight, and so the debris that builds up in the connective tissues via a lot of different situations, it can back up in there. It can go to the adipose tissue and just be stored there. That's not a good thing, really, because if that's happening, it's very difficult to get rid of that fat, and that person has to carry it around. They have to carry around their fat, and they have to carry around their toxins with them. So those kinds of things are not really ideal if the person doesn't really feel pain, and they still can benefit from being assessed, having their posture assessed, and having, a tune-up, so to speak. It doesn't mean that while they're on the table, we're not going to find spots that are common to everyone that don't need loosening up. And a lot of times, these particular spots that I'm talking about, like the front portion of the hip, for example, and the chest portion, the pecs here, and particularly the pec minor underneath, it doesn't mean that that person won't feel it on the table, because that's very common that, you know, those areas don't particularly bother people too much. And then when I get them on the table, sometimes even with just light touch, the person is going, "What are you doing to me?" You know? So it doesn't mean just because they don't feel pain, or just because they don't feel pain in the areas that need to be released, doesn't mean that we don't need to work there. Okay? What about just taking a Motrin or ibuprofen or aspirin or any kind of NSAID? These things are not good things. They are not good food for the body. They are quite toxic and quite poisonous, and they cause a lot of damage. They do nothing for the inflammatory process that the person is trying to be relieved of. What they actually do is they shut down the inflammatory process by shutting down one of the ways they do that is by shutting down the blood supply. So the inflammatory process can't happen, and then you have the same problem, but you also have no support for it at all, because the immune system has been shut down. The reason why NSAIDs are so dangerous is because they can also shut off the blood supply to organs. You know, when you put a pill in your body, it doesn't know where to go. It doesn't know that you mean it for a headache or you mean it for a back pain at a certain given moment. So it does everything to the organs as well. And I will do a whole separate video on NSAIDs, because I know just because our doctors are prescribing them for us, and just because we go to the emergency room and they give us a Motrin and tell us to take Motrin, and because it's over the counter, we think it's safe, and it's not. It's not at all. Okay, so with all of that said, then what should we do? Well, when a person is suffering from an inflammatory process and they have a sudden pain that comes up like that, it's the client's choice how they want to deal with it, because that's an inflammatory process. So they can come in and we can work with some osteopathic light touch techniques and get the inflammation down faster. And like I said, I could work on providing support for that structure. I can start to do that. But when a person feels that kind of pain, the kind that interrupts your life, the kind that's in your face, that, like I said, means that there's a bigger problem happening, and the whole structure needs to be organized. So in that case, the client really wants to reduce the pain, and then after the pain is reduced, it's okay to have some pain when you're going, but not that acute pain that I'm talking about. And then when you have the pain reduced, then you go seek a structural integrator that knows what they are doing, and you feel comfortable and confident with them. And if you invest in that kind of once a year deep house cleaning, as I call it, then what happens is the structure more finds a functional shape that is more usable to it. And so these aches and pains can't take hold as often. One of the reasons I created leverage movement therapy is because I found that, within a structural integration 10 series or 12 series or even 14 treatments per year, the client, that's a big investment for the client. And so every session I give my clients movement explorations to do. So they learn how to breathe in a way where they can get more mileage from that breath and more oxygen to their tissues. And they learn to walk in a way, or they learn to move in a way and stretch in a way that allows their body to not create these life-stopping pains, because tissues are being freed up. They're not gluing on top of one another. And also the work is being done in the brain. So when that person functions in their life, they can move in such a way that prevents injuries, and it also prevents these tissues from gluing together. It also, what I also like about structural integration is a very simple way the person can, if there's like an emotional component to the tissue tightening up, sometimes the muscle will contract, certain muscles will contract in the body just on their own. And when that happens, no massage or very few therapies are going to actually let that fist go, because the mind is clenching that certain muscle in a fist. And structural integration, craniosacral and lymphatic drainage as well, just via the process of it, may touch on that and just allow that issue that's making the fist actually not have a reason to be there anymore. So like steam off of a wet pavement, a wet hot pavement, it just evaporates, which is really nice. The person doesn't have to revisit things, they don't have to understand it. It's just a dysfunction on a different level that's gone. A lot of people, sadly, I'm not like this, so I didn't understand it. A lot of people, sadly, don't address these pains that come up in their life. They just tough it out and they say, oh, I'm okay, I've got ice on it and I'll be all right, or, I just have to take some time off the gym. I'm not a baby, they're saying in essence. I understand that, because for one thing, you didn't plan on this thing to interrupt the day that you had planned on. And then another thing is that we are conditioned not to take care of ourselves, to take care of everything in our exterior world rather than ourselves. It's really natural. So it's hard to take care of ourselves. This is why I've decided to do these videos, because I want people to feel okay about it. If you have a child, and a lot of you do have children or have had children, if they had a fever of 104, or they broke a bone, or they had some kind of pain, would you send them to school anyway? Or would you make them do the soccer meet? No, for somebody else, you would say, hey, rest, go see a professional, go to the doctor. But the thing is, with connective tissue, the doctors, that's not their modality. They're there to save your life. They're there to work with other things in your body. Connective tissue and muscles, that's not their deal. They don't know too much about it. They can take a look inside if you need an MRI, but I don't need MRI equipment or X-ray equipment. I can just feel, I can just see with my eyes, see the structure where it's the gravity is going to come down and there's nothing there to support it. So of course the tissue there, where there's nothing there to support it, has to get hard. I am learning a software where I'm going to be able to show you this on people. You know, I'm going to bring up a picture of a person and draw some lines on there and show you what I see when I look at people. But I have other tools too. Like I have my hands, and sometimes people come in, and especially during the structural integration, we can talk during that. I don't really recommend talking during a massage or the other treatments that I spoke of, but sometimes I really need to pay attention to what I'm feeling, and so at that time I'll say, hey, I need to listen with my hands, because I can pick up things that that person isn't going to be able to pick up in their life with their tissue. One reason is because maybe they can't feel it out of gravity like I can, or feel it in gravity like I can. You know, they're not in the position to do it. And the other one is that I've had training in such a way and practice in such a way of feeling several different things that are happening in certain areas of the body at the same time. So I hope that helps. You know, I should summarize because we covered a lot of things. Number one, the most important thing, if any of you out there experience a pain that stops your life, or there's pain on a regular basis, or even if your child is speaking about back pain or some kind of pain that they are enduring, then please consider seeing a professional about it, because even if the pain itself goes away, everything changes. So it will go away at some point, because you know you want to get on with your life and your body wants that too. But that doesn't mean that the problem has gone away. The problem has just adapted into something else. So it's actually caused another problem to be able to do that. Number two, stop taking NSAIDs. They are very dangerous and they don't do anything for the inflammation at all. Number three, when the pain has subsided, look into actually restoring the body to a functional position for you in your life. And I know it's not something that's common for us to invest in, but it is your body, it is your life. Invest in it at least as much as you do your car, or your kids, or your computer, or your food, or your entertainment. It really doesn't cost that much. And if you get really good quality work, then you can become like me and you don't have to worry about it at all. And you know, all the stuff can be fixed for a few $1,000s. I mean, total in a lifetime. All right. I'm Susan Nudowitz with Let'sFeelExcellent.com. I thank you for joining me. Have yourself an excellent day. If this video was helpful to you, please give me a thumbs up and share it with your friends. Thank you so much. Aloha.